Good morning. Today's global medical news, breaking scripts and headlines. The World Health Organization, WHO, has officially declared a public health emergency of international concern, PHIC, due to an aggressive Ebola outbreak involving the Bundibugyo strain in the Democratic Republic of Congo and Uganda. Segment 1, Breaking Global Alert, Ebola Emergency Declared. World Health Organization has just sounded the global alarm. It is officially a public health emergency of international concern. The details: over the weekend, the World Health Organization escalated the threat level of an Ebola outbreak in the Democratic Republic of Congo, DRC, and Uganda. Driven by the Bundibugyo strain, official tallies show at least 80 suspected deaths, 8 laboratory-confirmed cases, and 246 suspected cases. Why it matters: this is no longer localized. Unrelated cases have officially breached capitals, appearing in Uganda's capital city, Kampala, and the DRC's capital, Kinshasa, triggered by inter-country travelers. While the WHO states it does not currently meet pandemic criteria, international contact tracing networks are operating at peak capacity. Segment 2, Clinical Breakthroughs, the impossible pancreatic cancer pill and reversing cellular aging. Story A, the KRAS game-changer pancreatic cancer treatments are seeing an unprecedented structural shift. A new, fast-tracked pill called daraxonrasib from Revolution Medicines is successfully targeting metastatic pancreatic cancer in patients who previously failed grueling chemotherapy. It functions by aggressively binding to drug-resistant KRAS mutations. The FDA has granted early access to eligible patients while the drug undergoes active final review. Story B, zombie cell tracking. Graduate students working with the Mayo Clinic have designed an advanced method to spot and neutralize senescent zombie cells. By utilizing synthetic DNA sequences known as aptamers, researchers can seamlessly tag these cellular culprits linked to neurodegenerative diseases and aging, laying the groundwork for highly precise anti-aging interventions. Story C, DNA-guided CRISPR engineers at the University of Florida have shattered standard biology paradigms by creating the first system that uses DNA instead of RNA to guide CRISPR enzymes. This drastically reduces transcription errors, rendering future genetic diagnostics and therapeutics safer and significantly cheaper. Segment 3, Lifestyle and Preventive Medicine, the Silent Threat and Anti-Aging Habits. Story A, World Hypertension Day. Healthcare groups globally are spotlighting the rising tide of high blood pressure. According to the latest WHO brief, an estimated 1.4 billion people worldwide live with hypertension, but only 1 in 4 successfully keep it under medical control. Emerging clinical technologies, like the Paradise ultrasound renal denervation system by Recur Medical, are gaining traction by applying ultrasound energy to calm overactive renal artery nerves, successfully dropping stubborn blood pressure levels when daily medications fail. Story B, the multivitamin epigenetic link. New clinical trial data published by Science Daily reveals that a simple daily multivitamin significantly slows down biological aging. Over a rigorous 2-year track, older adult participants showed distinct reductions in DNA-based epigenetic clocks, serving as proof that basic nutritional consistency changes how our bodies age at a molecular level. Segment 4, Consumer Health and Regulatory Alerts, Nicotine Pouches and Menopause Heart Risks. Story A, the nicotine pouch crackdown. The WHO Tobacco-Free Initiative has issued an urgent warning to world governments regarding the massive surge of alternative nicotine pouches. Global sales rocketed past 23 billion units, fueled by sweet flavorings and marketing strategies that directly target youth populations. The agency warns that heavy adolescent nicotine exposure risks severe, permanent alterations to brain development, attention spans, and learning paths. Story B, Perimenopause cardiovascular drop. New metabolic data indicates a steep decline in cardiovascular metrics as women shift from premenopause to perimenopause. Studies show perimenopausal women are twice as likely to exhibit low overall heart health scores, alongside a massive 76% surge in poor cholesterol retention and insulin resistance, underscoring the absolute necessity for aggressive lifestyle adjustments before the postmenopausal stage hits. Restless leg syndrome. It causes your legs to move when you don't want them to. It can keep you up with strange feelings in your legs. They may tingle, or you could feel your skin crawl or have a pins and needles sensation. When it includes your arms, it's called periodic limb movement disorder, or PLMD. About 20% of people 80 or older have RLS. More than that have some form of PLMD. WebMD. SGLT2 inhibitors. Commonly prescribed SGLT2 inhibitors empagliflozin and dapagliflozin demonstrated comparable effectiveness in preventing major cardiovascular and renal events in patients with type 2 diabetes, T2D, without prior cardiovascular or renal disease. Medscape. Preventing nephrolithiasis. Evidence for preventing nephrolithiasis is limited, with pharmacologic strategies like thiazides and allopurinol showing potential benefits. Dietary interventions, such as increased fluid intake and specific diets, offer limited support. Lemon juice raises caution due to adverse effects. Medscape. Outro and call to action. Closing script, that wraps up your global medical update. Which of these breakthroughs or emergency updates surprised you the most? Drop your thoughts in the comments section down below. Don't forget to like this video, subscribe to the channel for your daily dose of science, and hit that notification bell so you never miss a breaking report. Stay healthy, stay informed, and I'll see you in the next video. Disclaimer: compiled information. This content is for educational purposes and is not a substitute for professional medical advice. The audience/viewers must verify the contents before use. The creator, publisher, and YouTube will not be responsible for any harm.